First of all, thank you for joining us today. I'm Sally Pace, and a few years ago when we started the Granite List, we knew we needed to create a resource for benefits leaders to help you cut through the clutter and streamline the process for finding solutions. But we've been so excited to see how it has grown, and today the site has become the most trusted resource for benefits leaders for searching and sourcing new solutions. Ironically, we started it in the middle of a pandemic. And coincidentally, another phrase was coined that was even more popular than the Granite List, and that was pandemic puppies. And so, Erin, I know you also have seen the surge of pet care in general, and so it's no surprise that it is one of the most searched topics on the Granite List today. I want to introduce you to two fabulous people. First of all, Erin Oakes is the CEO of United Pet Care, a voluntary benefits company currently working with thousands of employer groups and vet practices nationwide with a mission of making world-class pet healthcare affordable and accessible to pet parents everywhere. They operate as a pet healthcare membership program, an inclusive, uncomplicated alternative to traditional pet insurance, which saves employees 25 to 50% on every vet visit. Erin is also, because he loves animals, the co-founder of Fetch Natural Pet Market, a brick and mortar pet retailer focused on empowering pet parents to make the right nutritional decisions for their fur babies. And prior to his time in the pet space, he actually spent some time with non-pets, or also referred to as humans, in healthcare, working with payers, providers, and med tech companies in a variety of commercial leadership roles. He currently resides in Phoenix with his wife, Raquel, and their twin boys, Javi and Luca, and of course, two rescue pups, Loki and Archie. Also, meet Laura Francis, who has joined him today. She's a healthcare industry veteran with over a decade of experience as an insurance broker, a PBM consultant, and a compliance specialist. So she's hit the trifecta. She's currently serving as marketplace manager at Employee Navigator, Ease. And Laura is dedicated to shaping a healthier and more connected future in the healthcare. So Erin and Laura, the floor is yours.
Sally, thank you so much for that amazing introduction. And thank you all for the time, those of you that have joined. And just a quick note, we've deeply appreciated the Granite List partnership. We'll save the backstory, but entering into the broker channel has been a relatively new endeavor for us. We realized very quickly that in order to grow the way that we aspire to, two things needed to be true. We need to be as easy to do business with as possible, and that's largely through integrations with amazing partners like Ease, and that also channel was where it was at. And so it's been an incredible opportunity for us just to get our names out there and to help educate the broker community through a trusted partnership. So Sally, thank you so much for that. We'll try to keep this high level because I've always found the questions generally are much more interesting than my unbroken monologue. But we'll start with just a little bit of high level. Sally, you had a great teed up introduction. And I tell you, one massive thing that's changed in the 3 years I've been with United Pet Care is there's now very little kind of selling on pet as a category from a benefits perspective. It's almost always something that benefits professionals are hearing about, that HR professionals are hearing about really consistently. So the conversation has shifted from why do we need to do this whatsoever to acknowledging it is something that's high employee demand. And the conversation is more about, is the juice worth the squeeze? Is the administrative burden and the ongoing hassle of kind of a noisy benefit, quite frankly, historically, worth something that typically has yielded pretty low participation rates? So we'll spend most of the time talking on how we've developed a product and then also some integrations to help address some of those things. So fully appreciating that on the voluntary benefits side, we don't want our broker partners and our HR partners to be punished for doing something that's, quite frankly, something nice on behalf of their employees. But to start with just setting the table a little bit, the fur babies is very much a term of just a quick funny story. My wife in our vows committed to me that the number of pets would never exceed the number of human beings in the household. So we found out a little over, almost 2 years ago that we were pregnant with twins. We were walking out of the office, we're both crying, mostly tears of joy, just tears. And my wife looks at me before we even crossed the threshold and said, "Does this mean we can get 2 more dogs?" We have stuck at 2 dogs, so we decided let's keep the 2 human beings alive for a couple of years and see where we're at on that before more kids or more dogs. But we're a pretty typical family where we started with 2 fur babies and used that to kind of test the waters and delayed having kids. A joke that I've heard make the rounds is that plants are the new pets. Pets are the new kids, and kids are the new exotic animals. You have to be rich and a little crazy to think about having kids anymore. So, but anyways, now I think what's many people have realized is one, they love these little guys. They've, kind of moved from the backyard into the house, into the bedroom, and then into the bassinet in many cases. And the unfortunate kind of coupling realization, particularly when you're talking about a furry member of the family, is that they have healthcare costs just like the rest of the family. And a lot of people, first-time pet parents especially, are kind of unfortunately shocked that the type of healthcare treatments that, vets go to med school, the equipment is the same, that the costs are sometimes on par or at least, in that same ballpark as human medical costs. One of my favorite statistics from a benefit standpoint is that now actually more working Americans have recurring pet care bills than have recurring vision care bills. And the ever interesting left-hand side of that chart, that ratio for millennial and Gen Z pet parents is actually 2 to 1. So now 80% of millennials and working Gen Zers call themselves pet parents. Only about 40% have glasses or contacts. I use that analogy intentionally because from a voluntary benefits perspective, if an employer didn't at least offer, it's probably an unsubsidized 100% voluntary plan, but if they didn't offer you a couple of options to protect your eyeballs, you might wonder what type of company you had just gone to work for. Obviously, we've drank the Kool-Aid over here, but we feel that in the next year or two, pet benefits will be viewed on par with that, where it's no longer voluntary, but really an important selection criteria, particularly for younger employees. Making an assumption here that, again, most of the folks on this call have at least looked at or had some exposure to traditional pet insurance. There's a lot of text on here. I won't spend a ton of time on it, but the kind of reality of the situation is that oftentimes the reality and the expectation had not met up to the hype when implementing a pet insurance product. Average participation rates are about 1 to 2%. The enrollment flow is not really native or friendly, and the operations and utilization of the benefit can be really complicated and really challenging. And so you end up, again, with a big discrepancy between this is something that everybody's asking for, that nobody ends up enrolling in, and then potentially those that do end up enrolling don't have a great experience with the product. I want to say full out, we have an insurance product for our guys as well as United Pet Care. We view ourselves as very complementary. For a subset of pet parents, it can be really great to have both, and insurance can be a really great product. The aim that we have with ours is a much wider reaching product, which I'll talk a little bit more about, that's much easier to use and more largely applicable to your average employee. And without getting too deep into the weeds, effectively, a lot of these challenges are because it is an individual insurance product that gets kind of shoehorned into a group setting. And so that means that enrollment is going to a third-party website, answering 40 questions about Fluffy's health after you've already had your own brain fried electing your core benefits. And as we all know, once you leave that native enrollment flow, the attrition is extremely high, and that becomes a very difficult process. So how are we different? We are a true group product, and I'll talk about actually what we are. As Sally mentioned, we're a network-based savings plan. So we go negotiate rates on behalf of our providers. What this means in terms of implementation for a group is that every pet is covered, every pet pays the exact same rate, every group pays the exact same rate with no minimum participations or group requirements. And it means that we can actually achieve that native enrollment flow, which is something that is embodied nowhere better than in our partnership with Ease, which Laura will talk about just in a little bit. And at the end of the day, really what we aspire to be is a very quiet, high impact benefit. We can put butts in seats at open enrollment. It's really hard to get folks fired up about accidental death and dismemberment. No shade to that. It's a really important benefit. It's really hard to work a puppy into those marketing materials. You can do it, but it's difficult. And so what we want to do is be something that maybe even in a second or third year at a group, we can get folks really excited and re-engaged in their broader benefits package. Because as we all know, once you get that buying motion going and people are used to consuming voluntary benefits, the propensity to consume additional benefits goes up significantly. And then the last thing we aspire to be is really an extension of your brand as broker partners or as human resources partners. Fully appreciate, again, this is something that no company, no broker has to offer. So it's really important, not only that it's administratively quiet, but that it's a positive member experience as well. And one of the things that we're most proud of, we have greater than 90% confirmed benefit utilization and consistently 99% customer satisfaction ratings. So I don't think I have to spend a lot of time on this, but what we are, network-based, so a vet does have to be a network. We'll talk a little bit about that in a minute. The easiest way to think about it is 20 to 50% off of all in-house services that the vets complete. So for those of you that are familiar in this space, we're much closer to a wellness plan that we administer as a third party, where you can go to Vets in Network and start saving from $1 with no deductibles as compared to a traditional insurance product. In terms of what is covered, you can see kind of our defining features on the left-hand side: no exclusions, no age restrictions, no referrals or no annual maximums. And we aspire to be pretty comprehensive. So everything from those wellness and routine services that likely you're going to incur every year as a pet parent, all the way down to the unexpected, but sometimes inevitable over the life cycle of a pet: dental exams and tooth removal, tooth cleaning, allergy treatments, emergency care, up to hospitalization. The number one question that we get, of course, is always about the breadth of the network. And so you can see this is almost so zoomed out so as to be unhelpful, but we do have vets in over 80 major metropolitan areas. We do largely have our vet presence within major MSAs. It's where we can add the most value to our vets and where the highest employee and employer demand is. We started in the West Coast and Southwest, and as you can see, we've kind of spread up into the Pacific Northwest and then across the South and the Southeast as well. For individual group-related or specific questions, we can run geographic analyses. There's kind of lots of things that we can do to make sure that it's a good group fit. We also have a publicly available, easy-to-find vet search page where you can go in and use a zip code-based tool and not only search our veterinary providers, but also some of the other benefits that we offer, which I'll talk about just a little bit as well. So why we feel brokers love us. So again, we tried to be a simple, differentiated experience that can get people kind of fired up about their benefits package. Maybe most importantly, we're not regulated by the DOI. So you don't require a property and casualty license. There's no filings that have to take place. We don't have to go to the board or anything like that within an individual state. And so there just, again, kind of cuts through some of that administrative red tape and also allows brokers that maybe don't have a PNC or working on a PNC license to offer a benefit into their groups and kind of ring fence that group to make sure that somebody else isn't talking to your group about a benefit that you might not be able to offer. Want to call out, we are a post-tax benefit. Our lobbying arm hasn't quite gotten loud enough in Washington, D.C. yet, maybe down the road at some point, but there are actually some really good data that pets help shape human health as well. So something like 7 in 10 doctors have actually recommended pet ownership due to its knock-on positive health impacts, particularly for aging seniors, but even just getting folks active, getting socially engaged, lower obesity rates from dog walking. I know there's a GLP-1 webinar, I believe, earlier in the week that was, a couple different ways that you can tack at that, but getting out and walking with your pet is also has some really positive knock-on mental health effects is another one, big post-pandemic as well. So this chart is a little stilted, almost as if we wrote it, but there are lots of different things that we cover that are not covered in your traditional plan. Again, one of the things that I want to emphasize, we view ourselves very complementary with traditional pet insurance at an employer level if there's appetite, certainly at an individual level. And so we've actually found that in the instances where we're dual listed with a pet insurance product, we don't have a competing product. We will, I don't say never, but not in the foreseeable future will we get into an underwritten product, and we play nice in the sandbox there. So we have a lot of partners on the insurance side that we will go into groups with, and we actually see higher participation rates when employees have both choices made available to them. So as mentioned in the outset, kind of the core of our product is certainly the brick and mortar savings at the vet. However, my aspiration is that we can deliver a positive return on investment on a membership, even in a year where you may be fortunate enough not to have extremely high vet bills. And that's because, as anybody that's a pet parent knows, there are a large number of touch points and cost centers associated with owning a pet. I won't spend too much time on these, but a couple of the ones that are the highest utilization, we do have a 24/7 pet helpline. Service is fantastic, 30-second average response times, 99% customer satisfaction ratings. This is for what I call the Halloween candy question. And so it's midnight, dog tips over the kid's Halloween bucket. You need to know really quickly how many bite-sized Snicker bars before you need to be really, really worried. Anybody who's gone to an emergency vet knows it's $500 basically just across the front doorstep. And so our goal here is to actually have that cost avoidance, not having to go to an emergency provider by talking to a veterinary professional, getting talked off the ledge, and knowing whether or not you can just observe the pet. You do need to go to an emergency case, which is actually less than 10% of our calls that come in, or if you just need to be seen by your primary vet whenever the vet next opens for business or whenever they can next get you in. Another big one that's come up, back to the humanization trends of pets, we've unfortunately passed a lot of our chronic diseases onto our pets. Diabetes, weight-related diseases, also anxiety, depression, things like that. And so roughly 60% of medicines that are prescribed to pets have a human equivalent. So our plan covers any vet meds that are administered at the vet at a 25% off. We also have this kind of Good RX is the easiest way to think about it. Good at 60,000 pharmacies. There's a website tool where you can look up and offer that or see which pharmacies offer the benefit. And that's everything from insulin, Prozac, I mean, all of these things literally that get prescribed to pets on a daily basis, to some of the pet-specific medications that do have a human equivalent. And this is a huge place of member savings because right now, almost 95% of those medical transactions are cash pay, and we can save a tremendous amount, up to 90% on most of those prescriptions. The last two are mostly travel and convenience based. We have a partnership with Better Vet, which are in 35 different markets and will come to your home. And then Lap of Love, unfortunate part of the pet's life cycle, that is in-home hospice, euthanasia, telehospice consulting. And not to cut onions early in the day, but one of the things that one of our vet partners told me is that, when pets, that time comes and they're euthanized, they are almost always looking around for their owner and that assurance. And so the ability to do that and spend that time with your pet as you would a loved one, surrounded by their friends and family, in a dignified way is a really important value as well. One of the things that I've helped, fully appreciating that if this is a new benefit for you all as brokers or even as HR, you may be taking a risk and offering, is what's kind of that mental model of clients where we're really successful and we do really, really well. So by industry, you can see some of our average participation rates. We do really well in schools, hospital systems, professional services, nonprofit, and local government. And a lot of that has to do with kind of how that's aligned with our end user demographic from an income level, caretaker mentality, typically responsible for booking vet, appointments, and then painfully aware of how expensive vet related costs can be. So to kind of cut to the turkey, we're very consistent pricing. We are a payroll deduction benefit. The benefit for employers offering that is a 40+% discount off of our website rates. And so first pet is $17.50. Again, regardless of age, breed, pre-X, anything like that, they're all covered. And each pet thereafter is $16.50. We can integrate and do integrate with basically every measured benefit administration platform. Our strategic partnership with Ease and Navigator is the embodiment of that. They've been fantastic partners on both sides of the fence, and we're really excited for what's next to come there. Between those two, we have literally hundreds of groups activated and an average of greater than 12% participation rate. And with that, would love to hand it off and finally stop talking so that Laura can cover a little bit on Ease.
Awesome. Thanks, Aaron. Thanks for having me here today. I'm excited to briefly talk about the modern integration that United Pet Care has with Ease. Through this integration, it's easier than ever for employees to enroll into a pet solution through the Ease marketplace. I mean, there are so many times before UPC came and was integrated with Ease that brokers and employers were asking, when are you going to offer a pet benefit? So we're so excited that they're a part of our marketplace. It's one of the fastest growing, most asked about benefits. And really through our modern integration, it allows you to connect with United Pet Care for employees to enroll into their solution along with all of the other benefits they're being offered. And really in the back end, the integration is sending enrollments and changes to United Pet Care for a paperless experience. And this modern integration saves time. Again, no more paper, data integrity, and of course, as Aaron had mentioned, increases participation. For the modern integration United Pet Care has with Ease, it's very simple for brokers to go in. You connect through our marketplace. You open enrollment for employees to choose their plan. And then that automation happens where that data is sending directly to United Pet Care so that there is no more duplicative work happening on the broker or HR's end. And then again, limiting those number of errors being made and no more paper forms.
Thank you so much, Laura. And as Laura stated well, the last thing anybody wants is a part-time job managing, hey, somebody just got a new pet. There's no open enrollment restrictions. We get those files on a regular basis. We use Ben Admin as source of truth, which is hopefully music to everybody's ears, minimizes billing discrepancies, easy processing of terms. Again, all on the order of just trying to be as easy for you all to offer us with confidence as possible. Now, of course, the elephant in the room is the Ease to Navigator transition. Again, want to call out Ease and Navigator have been such phenomenal partners throughout this process. The highlights. We are available to be built out in Navigator. Again, we've got hundreds of groups that are currently live on Navigator. It is currently a manual process to pull down that file on a monthly basis, but that will actually be addressed as early as next month. So the Teams functionality, which is available in Ease today, will be available in Navigator. Basically, what that allows you to do is ship that work onto us. We will gladly take it. You don't have to give us unfettered access to the client's backend. We just get a login, and we can only go and pull down our United Pet Care related reports. So functionally, this gets a lot easier. We're already in the drop-down menu, and we have some pre-built kind of easy guides for Navigator. What we are moving is the best parts of the integration with Ease, which, as Laura said, literally a group can be set up in 90 seconds in Ease. We're going to move towards that in July with Navigator, and that's where the full EDI file integration will be completed. That's been confirmed with Navigator as a part of that release. And then any existing Ease groups, I know they've given a timeline, I think, of about 18 months, where they can be ported over to the new platform, and we would just be treated the same as any other benefit. All right. I want to leave a couple of minutes for questions. Hopefully there are a few, but at the end of the day, we view ourselves as kind of a mental health, financial wellness, and a pet benefit really all rolled up into one, and hope that after this you see fit in potentially finding some opportunities to work together. We're appreciative of the time.
All right. Thanks, Aaron and Laura, for going through kind of the logistics, the rationale, the future. And I so appreciate what you shared at the beginning. It took us 15 years before we had a human child, but our first one came out with 4 legs. It was a Weimaraner, and his name was Grayson because he was gray and he was our son. So definitely relate to you and your wife. As a reminder, for the Q&A or chat for questions, if you don't, and there's actually one that has come through the chat that says, what steps are needed to bring you into a new market?
So a new market is in like a new geography?
Yes,
or?
yes.
Yeah.
Meaning, I'm assuming they mean not one of them on the map already.
Yeah. So if we, a new geography, this is the fun of building a two-sided network. It's always chicken and egg. So the best way for us to go get vet partners, and we do have a sales team that's waking up every day only adding vet partners to our network, is to actually have some demonstration of employer demand. Now, this doesn't have to be a group that's signed contract. It could simply be, here's a large employer or a handful of employers in your area that would love to offer this benefit. That helps make it real and tangible for the vets so that we don't, it doesn't feel like snake oil. They can kind of conceptualize, I know this employer, I know the type of folks that work there. I would love to see those type of, folks as my clients. So the easiest way to do that, you can send sales at United Pet Care a note. I'm AOAKS at United Pet Care. Send me a note or click that link, and would love to talk about it and see what kind of that interest on the employer side looks like, and then we can launch. And actually, in the last 3 years, we've added a high number of new markets to the network, and so that is a very feasible process.
Also, another chat question: what pets besides dogs do you cover?
Great question. So if the vet in the network sees them, they're covered by the plan. So as you would expect, probably 93, 94% of our pets are dogs and cats, but we have a long tail, bad pun, of rabbits, pocket pets, ferrets, really a lot, exotics, lizards, those types of typically small and companion animal. Large animal is just kind of a different ball game. We do have a couple of large animal vets, but I kind of set expectations that it's mostly companion. But any vet or any pet that is seen by a vet is covered by the plan. And you have in our search functionality, you can actually filter by the type of animal. And so you can make sure that the vets that are returning are only, or that are covering those, especially if they're outside the dog and cat norm.
And another question that has come in is, can you revisit how this is fundamentally different than insurance? And I think maybe I'm going to read into, I hope I don't offend the questioner, also just reiterating that that it is indeed a voluntary benefit, or are employers signing up for a PEPM type of relationship?
Absolutely. So 95% of our groups are voluntary. We do have some employers that sponsor. That's becoming more and more popular, but no obligation. We have even better rates if it's on a PEPM basis. In terms of how we differ, the easiest way to think about it, we knock the vet bill down at time of service. An insurance company would go review that bill and decide whether or not to pay for it. We're not a financial intermediary. We make the market between the vet and the pet parent. The nice thing about the way that operationalizes for the pet parent is it's consistent and budgetable savings, and you're delivered at time of service. And so basically when you check out, you see this is what it would have cost. So recent example, we had to get 5 teeth removed from our middle-aged terrier, and it was $1,400. But through the United Pet Care savings, we knocked about $400 off of that bill. So it's still $1,000. It's still a pretty good sized vet bill, but we saved that, significant savings just right off the top. And then if we did have an insurance or submitted the claim to insurance product, it would go to the insurance company to pay after that.
Perfect. All right. One more through the chat is, I am asked offline by a number of plan members a lot about pet insurance. Any tips on how I can get HR to care more about this?
Yeah, it's a great question. It's the proverbial benefits manager island always, because there's sometimes that evaluation of, is this going to make my life harder, to offer something? I mean, I would say, there's a lot of good studies. There's kind of two appeals, right? There's the higher level of this is really good for employee retention. And there's lots of studies on, if there's that financial distraction, they're more likely to look and churn and things like that. To be honest, we found the greatest amount of success with the very pragmatic. This is not going to put extra work on your plate because we run everything through the benefit administration system. And, the easiest way to kind of do it or force the hand to say, when was the last time you asked your employees the type of, benefits that they're asking for? And overwhelmingly, it's always something that comes up at the top of the list. And so there's a way to, kind of quantify that a little bit. But honestly, I'd say the greatest success is making sure that they're confident that they're not getting a part-time job associated with this, because I've literally not had one HR person that said, we don't care about our employees' pets. It's when it comes down to it is, again, are they actually going to take action on it? And most of that is lowering the operational barrier as opposed to convincing them that it's something that's good to do.
Thank you for joining in. Thank you for being part of the Granite List community. And as Aaron has so kindly shared his, not only the open-ended email address, your direct email, I hope people will take you up on that. And Laura, thank you so much for the work that you guys are doing in helping make it easy to integrate pet benefits into plans. Thank y'all very much for today.
Thanks so much, Sally. Thanks, everybody.